A pleasant day to you, sir. For our group presentation, we will discuss our research entitled Workplace Violence and Level of Anxiety Among Emergency Department Healthcare Workers in Cotabato Regional and Medical Center. This research is presented to the faculty of the Graduate Studies Program of Davao Doctors College Incorporated, Davao City. In partial fulfillment of the requirements for the degree of Master of Arts in Nursing, Major in Clinical Management, Subject N107, Human Behavior in Organization, Class 27A. This research is presented by Mr. Jim Marvin A. Maguate, RN, Ms. Juliet M. Mandin, RN, and Ms. Sulaila S. Mariano, RN.
Introduction. Workplace violence has become an alarming phenomenon worldwide. The real magnitude of the problem is largely unknown, and recently information shows that the current knowledge is only on the tip of the iceberg. While workplace violence affects practically all sectors and all categories of workers, the health sector is at major risk. According to the National Institute for Occupational Safety and Health, workplace violence is defined as a violence act including physical assaults and threats of assault directed towards person at work. Violence is further defined by typology, the criminal intent where the perpetrator does not have any reason to be in the place of business other than committing a crime. The customer or the client where the perpetrator of the violence is receiving a service from the victim. Worker on work where the perpetrator is current or previous employee of the business, and the intimate partner violence where the worker's intimate partner perpetrates an act of violence in the workplace. Customer or the client violence is the most common type of violence reported in the healthcare industry, and emergency department healthcare workers have been recognized as being exposed to a higher prevalence of this study of violence compared to other healthcare workers. Patient assault has been identified as the primary cause of violence related injury suffered by emergency department. Dementia, schizophrenia, anxiety, acute stress reaction, suicidal ideation, and alcohol and drug intoxication have been found to be the predictors of physical violence perpetrated by patients against healthcare workers. On the contrary, verbal violence is frequently perpetrated by patients in a lucid and normal state of consciousness. It appears that emergency department staff in an environment where they are constantly exposed to situations with aggressive individuals. The effects of violence can range in the intensity and include minor physical injuries, serious physical injuries, temporary or permanent physical disability, psychological trauma, and even death. Violence may also have negative organizational outcomes in the form of low worker morale, increased job stress, increased worker turnover, reduced trust of management and coworkers, and lastly, a hostile working environment. Thus, the aim of this study is to evaluate prevalence and impact of violence in the healthcare workers in the emergency department of Cotabato Regional and Medical Center. This also aims to determine the frequency exposure to violence, characteristics, and impact of violence towards healthcare workers. Objectives of the study. Generally, this study aims to determine the violence and anxiety encountered by healthcare workers of Cotabato Regional and Medical Center. Specifically, this study aims to determine the workplace violence encountered by health workers, to determine the level of anxiety of health workers, and lastly, to determine the relationship between workplace violence and level of anxiety encountered by health workers.
Chapter 2: Review of Related Literature. Workplace violence is prevalent in healthcare and remains a complex and serious occupational hazard in healthcare settings. Incidents of workplace violence in emergency departments are increasing and have become one of the most significant and problematic issues. Research dating back to the late 1990s has provided evidence linking emergency departments and workplace violence that 42 to 57% of the emergency department workers were physically assaulted over the 1 year study period, and 72% of them over the span of their careers. Emergency departments are a highly dynamic and stressful care environment that affects staff and patients' outcomes, with particular risks to staff's well-being and quality of care. There are numerous adverse work factors identified, such as heavy work demands under time pressure, high patient turnover, staff shortages, increased patient morbidities, exposure to violent individuals, and lack of effective workplace violence prevention programs and protective policies or regulations. Studies conducted in emergency departments have suggested that long wait times, excess noise, overcrowding, feeling of lack of caring, being given bad news related to diagnosis or prognosis, and ineffective interpersonal relationships are all possible risks for workplace violence. The lack of intervention studies is problematic. To date, most of the studies in workplace violence in healthcare settings are mainly exploratory and descriptive in nature, focusing on correlational retrospective, survey-based, or predictive designs. The majority of the literature reported the prevalence, sources, and types of workplace violence, recruited mixed professional groups or settings, and identified various and interrelated determinants, risks, contributory factors, and prevalence across various hospital settings in relation to workplace violence or other specific types of workplace violence. In spite of large variations in study design, study population, settings, components of interventions, and outcome measures, several positive research results were found. These are my references. Thank you.
Chapter 3: Methodology. This chapter will provide a description of the research methodology that will be used in the study. This will include details about the participants' criteria for inclusion, who will be the respondents, what research design to be selected for the study, as well as the reason for the selection, and tool to be used for data collection. We will also discuss how to analyze the data collected. Research design. We will use qualitative method by using in-depth, face-to-face, and semi-structured interview to collect data. Semi-structured interview guide and develop based on prior studies that will be conducted to allow researchers to ask follow-up questions during the interview if clarification and additional information will be needed. Since the respondents' subjective and objective opinion are expected to be the main subject of their study, thus needed a narrative and descriptive approach to address the topic. Research Local. The study will be conducted in Maguindanao Provincial Hospital, a public facility located at Maguindanao Province, since the main objective is to determine the workplace violence and level of anxiety among emergency department health workers. Research Respondents. The respondents of the study will be consisted of 20 health workers of emergency department, which include doctors, nurses, midwives, and nursing attendants of Maguindanao Provincial Hospital. Random selection of personnel will be collected. Data collection. Researchers will obtain a consent from all respondents and no personally identifiable information will be collected apart from the participant's job title. Semi-structured, in-depth, face-to-face interviews and field notes will be used for data collection. Interviews will be recorded and transcribed. Data analysis. If respondents' answers have already been translated into text, raw data needs to be converted to refined data for researchers' analysis. The raw data will be translated into English from Tagalog for data refinement. Refined data will be used for thematic analysis, a hybrid thematic analysis approach used to determine dominant themes. It emphasizes identifying, analyzing, and interpreting qualitative data patterns. With this analysis, you can look at qualitative data in a certain way. It is usually used to describe a group of texts, like an interview or a set of transcripts. These are my reference. Thank you and God bless.